Hello, my name is Pilar Camargo-Plazas. I'm an associate professor in the School of Nursing at Queen's University, and today I'm presenting on behalf of our team the results of our scoping review exploring diabetes self-management education for older persons in Western countries. We'd like to acknowledge our former research assistants and our funding agencies. Globally, diabetes is a growing chronic illness. An estimated 462 million adults live with diabetes and its complications. The prevalence of diabetes in adults 65 years and over is expected to increase by 2045. Self-management and education are crucial for controlling diabetes and its complications, yet the successful uptake of diabetes self-management education programs is not straightforward, and little is known about diabetes programs for older adults. Within this context, a broad overview of diabetes self-management education for older adults, considering all types of related evidence, is needed. The purpose of our scoping review was to map the available evidence on diabetes self-management education programs for older adults in Western countries. In this slide, we are presenting our review question, inclusion criteria, the method we follow, which was the JBI methodology for scoping reviews, and our search strategy. We extracted descriptive characteristics from the records and also specific characteristics of the reported diabetes self-management education programs. This diagram shows the process of selection of the papers presented in our scoping review. We included 42 articles in our scoping review. Most of the articles were from the United States, most were quantitative, and most were developed in community settings. The length of those programs or interventions ranged between 6 weeks to 2 years. In only one record, the researcher reported ongoing education. Most programs were facilitated by diabetes specialists, diabetes educators, registered nurses, nurse practitioners, psychologists, nutritionists, physicians, or pharmacists. Of all 42 papers reviewed, none reported a definition of diabetes self-management education by older persons, and only 36% presented a definition of diabetes self-management education. Most of the studies follow a structured program of education, curriculum, and certified training, which shows a traditional model of education. Most of these programs were developed by multidisciplinary teams, and only in 2 studies the voices of older persons, family members, and caregivers were included in the development, design, implementation, and evaluation of the programs. Topics covered by these sessions were nutrition, monitoring, treatment options, physical activity, short and long-term complications. There were also topics related to food care, pathophysiology, psychosocial support, lifestyle modification, care coordination with specialists, problem solving, goal setting, risk reduction, and behavioral coping. Most studies presented behavioral change as a primary outcome, and the majority of the studies had knowledge as a secondary outcome. In terms of the key findings of this scoping review, diabetes self-management education improves metabolic and behavioral outcomes, requires content adaptation and tailoring, is a long-term process where goals should be discussed with older adults and caregivers. In a qualitative data showed that diabetes self-management education was unnecessary or repetitive. Finally, recommendations going forward reinforce and bolster as well as build additional diabetes education after diagnosis and follow-up, exploring greater depth the education process itself, for example, the type and quality of education received by and from healthcare practitioners, expand research about the mental health and well-being of older adults living with diabetes, expand research about measuring the long-term effectiveness of interventions and sustainability of the programs, incorporate the voices of older adults and family caregivers in the research process, and explore the reasons for considering diabetes self-management education as unnecessary or repetitive, investigate the development of a diabetes self-management education program for older persons living in vulnerable circumstances, and integrate more qualitative research and facilitate the engagement of persons living with diabetes in design of these programs. Thank you. References of our study.